Hey guys, Dr. Nagel here. Super excited to bring you a new technology that we brought into our office. As you know, I've talked about stem cells. I'm really excited about that technology. The downside, and I've spent a lot of money having stem cells and PRP and exosomes injected in my knee, which I've had really good results with. But it's a little expensive. It's highly effective, but it just doesn't feel like everybody has the ability to do that. So I was exposed to this tissue regenerative therapy, TRT. It actually is revolutionary technology. It's been in Germany for 12 years. Actually, the technology existed 30 years ago, but they've been using it to stimulate stem cells and joint healing, and actually lots of different applications. As I do more and more of these Facebook Lives about TRT treatment, we'll talk about all the different applications that are happening, from cardiovascular to veterinary and erectile dysfunction. But we're not doing all that. We're sticking with the joints and the things that we're really good at. So I tell people that we can get most things better. So, shoulder impingement, hip flexor problems, IT band issues, whatever the case might be. But there's always those cases that you just, with your soft tissue work, with your release work, with your strengthening, that you just can't get better. And that's where this guy steps in. So, I had a case. This is Stephanie. She's agreed to come in and talk about this. She just popped in while she was gardening to get an adjustment. And this is a case where she came in, she's delivering babies, she's injured her shoulder, and we worked for a couple months on it and got better, but not all the way better. And we want things to get all the way better. So I actually referred her down to Dr. Joe Fortin, who does a great job. He did the work on my knee, and he does liposuction, pulls out stem cells, injects them in her shoulder, and then you get some follow-up shots with PRP, and did great, right? What was that, 3 years ago?
Yeah, well, just over 2. Yeah, done wonderful.
Yeah, and this is regenerative medicine, which is root cause. I mean, that's what we're totally into. But the understanding is when you need booster shots, right?
Right.
So here we are. Stephanie's shoulder's starting to hurt again, and it has grinding, which is calcific tendinitis. And we did a treatment, and how was that?
It felt a little different. You could feel as the machine went over, it almost like would find the scar tissue, and you'd feel it get sore, and then it would literally pop like an explosion in your arm, and then instantly the pain just went away. So
yeah, so it has the treatment up front, basically blows out the inflammation. So you get some relief right away. But what it does is it actually stimulates this paracrine effect. So it pushes these energy waves into the cell membranes, and these cell membranes open up and they let out exosomes, which I had injected in my knee. And these exosomes are communication factors. So they go and recruit resident mesenchymal stem cells. So they're stem cells that are just kind of hanging out. They're sleeping. It wakes them up and brings them to that area for healing. So we'll do a couple treatments in a row, and then we start spacing them out. But this is like a 3-month long. I mean, the studies show that there's healing for 3 months. And then she had some grinding in her shoulder. And what would you say after we did the second one? What's happened to the grinding?
I have almost no grinding whatsoever now. Just my normal, I would say it's equal with the other side now, just my normal old lady achy shoulders from overuse. But as far as feeling like the glass, I felt like I had just glass poking me, and that is gone.
So interesting. I mean, sometimes I get frustrated in our culture because we get everything late. They've been doing this in Germany for a long time. There was a study in 2004 that showed a large group of patients with calcific tendinitis, and of the placebo group, so they got a sham treatment, it wasn't a real treatment, none of them had a reduction in the calcific tendinitis. And in the group that actually got the treatment, and they only had 2 treatments, so the group that got the treatment, it actually completely removed the calcium, or mostly removed the calcium, and I think it was like 43.7% of the patients. So that's remarkable. I mean, I don't know anything else that can do that. We got this machine. It's a very big investment, but we are always trying to close the gap, just like with Stephanie, you know, we did what we could. I couldn't get her all the way better. I needed to close the gap. I sent her out to close the gap. This is helping us close the gap. And when I bought this really expensive machine, he said, well, the Cubs have one, and the White Sox have one, and we have one. So that's pretty cool. So that's your little tip for the day. I'll be back doing some stuff on autoimmunity and functional medicine, and then diabetic neuropathy. We have some people we want to interview where we can reverse diabetic neuropathy with this treatment. So see ya.